So this is our upper and lower extremity strength monitoring spreadsheet, and it's something that we wanted to put together to seamlessly track and monitor athletes' strength throughout their course of rehab, whether it's for the upper or lower extremity. As far as some simple instructions, all the data is going to be inputted into the gray cells, which you'll see on the following pages. We need to ensure that we're calculating the person's body weight and then measuring the moment arms accurately, as these can definitely affect the outcome of the strength measurements. So once the data is inputted into the cells, the spreadsheet will automatically calculate either the limb symmetry index or their peak torque values, depending on what you're measuring. So on this next page, we have our metadata and subjective section. So in this column here, we can enter in anything along the lines of the person's name, age, weight, injury, or position. And then on the right side, we have the date of surgery or injury, today's date, and then days, weeks, or months since the surgery. So if this is something we want to track, we can simply just enter it in. And then any subjective information that we want to add about the individual, we can pop in right here. And then as far as serial data tracking for either the upper and lower extremity, we can enter them in these boxes right here. So for example, if we have lower extremity and we tested on January 1st of 2025, let's say we did quadriceps, we can enter in 115 versus 120, and it's going to spit out our LSI at 95%. And then we could do the same thing for the upper extremity if we happen to be treating an upper extremity case. So here we have the lower extremity portion of the strength template, and it looks like there's a lot going on, but once we enter in an example, you'll see just how easy it is to follow along and interpret the results. But before we get started, we're going to come over to this gray cell here and enter in the person's body weight. And then if we're doing a knee extension and knee flexion example, we're going to enter in the moment arm. So this would be the lateral femoral condyle to the center of the testing strap, and typically a standard tibia length is 0.35, so we'll use that for this example. And then we'll come up to the top here in the knee flexion column. For the left side, we'll go 60, and then for quadriceps, we'll go 90. And then let's go right side, 70, and then 100 for knee extension. So then everything's going to be calculated. We can go right to the right over here and then see their hamstring to quadricep ratio. So we got a 0.67 versus a 0.7. Then we can come down to this row here, which is going to spit out their peak torque. And then at the bottom in the orange, we have the quad LSI and peak torque, left versus right. And then in the gray here, we have the hamstring peak torque and LSI spit out as well. And then we can compare these values to some of the normative data that we supplied down here. So again, a lot going on, but once we plug everything in, very easy to kind of see where this athlete is at. So lastly, we're going to move on to the upper extremity portion of the template. So pretty much the exact same setup as the lower extremity. Typically for the upper, we're not really measuring moment arms. So as far as the bottom portion here, we don't typically use that. We'll stay on the top left here. So let's use a shoulder example. Left side, let's plug in 20 for ER, left, 30 for IR left, and we'll compare that to say 15 ER right and 25 IR right. So if this person is right hand dominant, we can see right here index-wise that there's 75% LSI for ER and about 83% LSI for IR. And then if we come over just to the right here, we can see their ER to IR ratios. So on the left side, we have 0.67, and then on the right, we have 0.6. And then we could head down here for some normative values for ER, IR, as well as ER to IR ratios. So again, just a nice, easy way to see exactly how this athlete tests, and then we can track this over time.